again. Welcome everyone to the Wednesday morning. No, I'm so sorry. To the Thursday morning series. I wish I'd said that before I hit record. But this is a special edition webinar. Dr. Stevie Hall and Lindsey Stanley, who have co-authored a workbook on therapeutic separation, are joining today. And so I'm going to turn it over to them. They can talk a bit about why they created this, and but I'm gonna turn it over to the two of you right now.
Hi, everyone. Thank you so much for being here. I'm Lindsey Stanley. I'm with Pecan Counseling in Dallas, Texas.
And I'm Stevie Hall. I'm also located in Dallas, Texas. I'm also licensed in Colorado and Florida as well.
So Stevie and I met actually in the CSAT training. I think we met starting off in Mod 1.
Yeah.
We're table mates, I think, for Mod 4, and just really kind of hit it off and became colleagues that collaborated over the years and really enjoyed working together. But one of the most common things we would run into that was just a pain point with the clients we'd work with is not having adequate or clear resources specifically addressing therapeutic separation and how to help clients navigate through that period of time with more clarity and more assurance, as well as helping them really address whether reconciliation is possible or if further separation is needed. So we worked for a period of, I would say, I don't even know how long it took us, probably a couple of years to create the workbook that recently came out earlier this year that really is designed to help both parties or all parties in a relationship to work through the same material at the same time, supporting them so that everyone has a clear idea of what's being worked on, what's being addressed. So there's more clarity and containment around therapeutic separation. So we tried to break it down as much as possible for a very complicated topic, but I'll let you go, Stevie.
Yeah. So before we really dive into therapeutic separation and into the nitty-gritty of it, the workbook really walks you through from the beginning of thinking, should I take a therapeutic separation? How do I know which type of therapeutic separation? What are the signs that maybe it would be helpful to initiating a therapeutic separation, walking through all the different questions you should ask yourself, creating a contract, disclosing to children, disclosing to friends, all of the individual work you need to do. I think we've got over 60 pages of individual work for both partners, and then into evaluating, should you reconcile? Should you ask for more time? Should you permanently separate? Those are all separate chapters, and then kind of conclusion and moving forward. And I think we include a lot of information throughout that's supportive and that's connecting. And we really recommend working through it with a therapist if you can. And it's really helpful for therapists to use as well.
Absolutely. So I am going to open up our PowerPoint. Just give me 1 second. There we go. Bear with me for just a second as I get this in present mode. There we go. Okay. Stevie, can you see that clearly?
I can, yes. Well, no, actually, no. It says it's an audience window. I think you have to close out of that or enter full screen.
1 minute.
I think just right there on present, Lindsey. Does it allow you to do that at the top?
Then 1 second. Oh, there we go. Okay. Present in full screen. There we go. We got it. Thank you. Yeah. Technical support. I saw a question about getting the slides. If anybody would like the slides from our presentation, they are more than welcome. We're even happy to email them to anybody who would like them. So a little bit about us. My practice focuses predominantly on addiction and recovery, chronic relapse, and complex trauma. And Stevie, if you want to share a little bit about your practice before we go back.
Yeah, very similar. I work a lot with sex addiction, infidelity, sex therapy, and trauma. And I work with the whole spectrum. So I work with addicts, I work with partners, I work with couples, in all of these different areas. And for couples work, I use a lot of emotion focused therapy from Sue Johnson's work, which is pretty incredible if you're not familiar with it.
So this is the cover of our workbook, but we'll skip on through. So these are all the
Mhm.
different elements that we'll be covering today in the presentation, the different types of separation, as well as how to identify whether or not this could be a need for someone or for yourself individually, how to implement and plan a separation effectively, and then just kind of steps for reintegration. So Stevie, I'll let you take the research.
Sure. So when we're talking about separation, a lot of times what happens is that couples take an ambiguous separation where they know that they need time apart, but there's no really structure around it. And so then they just start deciding to separate. So they might live in different homes, they might separate within the home, but without structure and without any sort of timeline for the separation. And when that happens, we call that an ambiguous separation. And so it means you're not married, not quite married, you're not quite divorced, but you're not really sure where you're at. And so when you look at the research of, well, what does that really mean when we're in separation? There's a few different definitions that come up for people. And you can click next, Lindsey. Couples take separation for a variety of reasons. Sometimes it's because they feel like they need the time apart. Sometimes it's because they feel like the relationship is hopeless and they just can't move forward. Other couples feel like if we could just take a pause, things would get better. But oftentimes separation offers the couple the time and space they need to assess. And we'll talk more about that when we get into therapeutic separation, but that's really why you see kind of this pivotal moment in the relationship, because there is so much stress and tension, and then this feeling of we just need to step back and see what's going on.
Are all separations the same? Definitely not.
Mm-mm.
So we identified in our book 4 different main intentional types of separation. Although I would say the most common form of separation is ambiguous, which is exactly what Stevie was just describing, where there really isn't a lot of clarity. It's more just space. Therapeutic separation is an intentional structured time apart with the goal of support and healing, where there is clear boundaries, clear expectations, as well as identified either check-in points or an identified kind of landing zone where it's assessed and evaluated whether it should be extended or if the therapeutic separation should end, either to reintegrate, further separate, or terminate the relationship. Controlled separation is essentially living in the same home. For some couples, it's not financially feasible, or there's different circumstances where it's not going to be as feasible to fully separate and have 2 different living environments, where basically you're going into like roommate mode with very intentional boundaries to romantically and emotionally disconnect for the purpose of really engaging as much distance as possible. Sometimes for parents of little kids, that can be a little bit harder to take a full-blown therapeutic separation where you're living separately, just logistically. Legal separation is where you're essentially working with an attorney to separate legally on paper. Sometimes that does involve living separately. There are different benefits and risks of going that direction. Texas, interestingly, where we practice, it is not an option in Texas to legally separate, but depending on the state that you're in, that definitely can be something to be explored. Permanent separation is essentially where you are deciding to terminate the relationship but stay legally married. There's all different kinds of reasons why couples would land on this. Sometimes cultural or religious beliefs can drive whether or not someone would land in this category. Any other comments, Stevie?
No, that's great.
Stevie, you want to take this one?
Yeah, absolutely. So, separations, do they need to be therapeutic? There are many risks of non-therapeutic separations, and we'll go through and break those down so you have a better idea. But essentially, they become ambiguous. There's negative mental health effects. It creates this difficulty with uncertainty. It's hard to tolerate when you don't know is the relationship going to continue? Are we going to split? And you don't have that information, then it creates this difficulty being able to tolerate that ambiguity and uncertainty. It creates uncertainty of the relationship's future, which could lead to all sorts of other issues. Are we dating other people? Are we not dating other people? Are we joint buying this thing together? Or are we not? What do we do with our house? How do we celebrate holidays? And all of those things create a lot of distress.
One other thing I threw in there too, something we found very interesting as we were looking into the research of separations is there really isn't much research on separations as to whether they're beneficial or
Mhm.
helpful. So oddly, this is kind of a category where we don't have a ton of information. And I think it also was interesting that there was a lot of overt bias that people have that separation leads to divorce, but there's no clear evidence that that's totally true. And the sample size of the research that we were able to find was actually relatively small. And pretty much everything we found was more ambiguous in how the separations were conducted.
Yeah, and I'll just add to that real quick. Lindsay, I just pulled a research article recently, I think from 2016.
Okay.
And they were looking for couples to interview, couples who had separated and reconciled to figure out what worked in that relationship. And when they initially tried to recruit participants, they put the information out there to recruit. And I think a whole year went by and no one signed up for the research, so they had to put it back out there. And the point is, it's just even when there's people trying to research it, it's really hard to get the information. So I think of all the articles I've sifted through, maybe there's been 3 about separation. That's not divorce, but actually like separating temporarily. And so we really need more research in the field. Yeah.
So this is further kind of exploring how in this specific study, just the lack of clarity was very clearly distressing. And that was a major theme within the Crabtree and Harris study that we found.
Can I
As-
ask a question? Because like
Yeah.
when we're talking about all of this research, and I'm assuming a lot of this is in any relationship, like we're talking about it within the realm of, addiction and betrayal, but what I hear you saying is there isn't research on couples that have separated for any particular reason.
Nope.
Okay,
That
thank
is
you.
correct.
Wow.
So if
Mhm.
anybody would like
Yeah.
to research that more, there is a huge need and a very large gap. So
Yeah.
Stevie, I'll let you take this one.
Yes, I'm going to go through these quickly just for the sake of time. And what I'm essentially doing here is I'm going to walk us through the research study from 2020 and all of these different points, just so that you can understand more why ambiguous separations can really be harmful. So these are non-therapeutic separation experiences that we're going to talk about here. So when a separation is ambiguous and it's not intentional, it creates an unknown relationship status. That creates very confusing boundaries, like I mentioned earlier. How do we handle finances and holidays and pets and vehicles and everything else? The separation terms are very unclear. And so when you look at this study, some participants didn't know if they were dating, if they weren't dating. Some people started dating other people. And again, this isn't in the context of betrayal, right? This study is just couples in general. And so it really creates a lack of clarity for the couple, but it also creates a lack of clarity for children. Right? The separation also tended to be a lonely experience because there were no boundaries in place for communication, for couples therapy, for meeting and going on dates to repair the relationship, for any sort of connection. And so it created a difficulty being alone. There were daily reminders of being alone. And actually, we talk about this in our book in chapter 3. It goes over triggers and how to manage those and walk through those different reminders of the separation. But if you haven't done that work, then you're just meeting all of these things. If your partner walked the dog every morning and now you're the one in the home separated, now you're reminded every morning when you walk the dog about the separation. There's increased responsibility, and if you're a parent, solo parenting. It's also a pretty private experience. So I'm sure many of you can relate that you might have gone through a lot of this experience alone or isolated. So when separation happens, it's not all of a sudden you start telling everyone what's going on in your relationship or your life. So there tends to be a fear of others' perceptions. And also this ambiguity of what should I share with others? Because if we get back together, I don't want them to think one thing or another thing, or how much information should be shared. So overall, it just creates a lack of support and help. It's also not sustainable to do an ambiguous separation for many reasons. One is that there's the uncertainty of the future is just too much to bear and to experience. Um, the emotional toll from ambivalence of going back and forth and not sure, should I just get back together because this is way too uncomfortable, or should we just separate because it's way too uncomfortable? That becomes very exhausting in time. It also feels like your life is on hold, right? There are lots of things that maybe you can't do or you want to do, but it's difficult because you're in this ambiguous spot, and that can also create paralyzing feelings. And the outcome is unclear. So when you remain unclear about a decision in your relationship because of the ambiguity, it creates unresolved questions, and then that will motivate you to divorce. When you look at this research study, there were some couples that said, "I thought that we should just divorce because I'm so tired of being unclear, and I just need something to feel certain, and I just need a path forward. And if that's divorce, it's divorce." And it's unfortunate that that happens because some of these couples did get back together eventually, or when they did separate, they felt like, actually, I feel like we really could have worked it out. We just didn't know how to. And so, again, this creates like a lack of clarity around reconciling.
So diving into the meat of therapeutic separation, and we probably have more slides than we'll be able to get through our time together, just because there's so much to cover. We're actually teaching a class with ITAP tomorrow for 8 hours on this topic. So this is a lot more
Yeah.
consolidated for you guys. But the three major points of a therapeutic separation are having structured time apart, space to reestablish safety and stability, and collaboration. Really the meat of therapeutic separation is how you use the time apart, and what you work on can really make or break whether a therapeutic separation is going to be helpful and effective. We recommend this model being used predominantly with a licensed therapist, and we do recommend to have that high level of support and structure. The model that we propose is very similar to kind of the disclosure model, where you have what's considered a contracting session with both therapists and both and all parties in the relationship there for a therapeutic separation contracting session, where you're basically kind of identifying the boundaries of separation and have everybody kind of agree and nail down on what will be happening during the time of the separation. So we recommend generally a period of 90 days. That's kind of what is clinically recommended for each relationship. It's going to be different. And so for therapists, we recommend using kind of clinical judgment as to what would be best for the people that you are working with. We recommend having a clear contract, goals and boundaries. The individual work will happen at the same time, but separately. And we do recommend that if you are going through a therapeutic separation, that whatever professionals you have working with you, that they would have the releases to be able to collaborate together, so that they can support you and make sure that the boundaries are being upheld, but also pace the timing of whether reintegration should be attempted, and or whether couples work might be recommended, because sometimes that can be helpful as a part of therapeutic separation, less to fully reintegrate the relationship, but more to kind of have check-in sessions with the therapist present. Okay, so reasons for a therapeutic separation, all kinds of things, but within the realm of addiction, we really dive into this further in the book. But if you are experiencing a point in your relationship that I call like scorched earth, where continuing to press in and continuing to try to repair is creating more trauma than actual repair, probably this might be a good fit for the relationship. For some people, it's early on and just finding out that their partner kind of had a whole other realm of life happening for them, and the pain of discovery is so large that the idea of trying to figure it out in close proximity is too painful. But if you and your partner have kind of been walking in the journey of, as your partner's gotten sober, as you've worked on just the wounding that you've experienced as a betrayed partner, if you are experiencing boundary violations, continued relapse, emotional, psychological abuse, anything that is creating such a toxic environment for repair, these can be great reasons to consider a therapeutic separation. Basically the slide kind of goes further over exactly what I just described. But I would say most commonly I find, whereas a therapist, the thought of even proposing or discussing the idea of a therapeutic separation, where it will come up for me is if I'm noticing a cyclical pattern of toxic conflict, that is really leading to more and more chaos and less resolution. That typically is when those indicators are showing me as a therapist that, hey, this might be something worth considering, or at least collaborating with the other therapist about whether this option could be helpful.
Yeah, and just to add to that, Lindsay, in addition to what you shared, because that's oftentimes when my clients also take a therapeutic separation, when I feel like the couple is on the brink of hopelessness, like they haven't quite gotten to being hopeless, but it is right there, that is typically a sign for me too, because they are about to push themselves into just not being able to tolerate anything and not feeling like there is a way out. So that is a pretty clear indicator for me as a therapist.
Yes, absolutely. So benefits of separation. Pressure off relationship, gives room for yourself, for self-care, and room for genuine and authentic change, for the development of insight, and most of all, clarity. Okay, Stevie, you want to take this one?
Yeah, so, when we're bringing this up with a client, I think it's really important that that as therapists, we don't ever tell a client they should take a therapeutic separation. But there are times where we talk about the various options they have, and a therapeutic separation might be one of those options on the menu, so to speak. So a lot of times when we're working with a client, we're going to discuss that, the relationship feels like it's in a stuck point and there's a need for change. And we present these different options. And then there's a lot of fear that comes with therapeutic separation for so many reasons. So we really try to spend a lot of time with our clients validating the fear and then discussing what the process of a therapeutic separation looks like, because it's, I mean, we're going to go through it right now, but it's, it's pretty in depth. No. I think one of the first things you want to do in taking a therapeutic separation or thinking about it is just to process your emotions. There's a lot of fear, shame, anger, disappointment, sadness. And so, really, just taking the time to talk about that with your therapist or your couples therapist is important, because this is a bit of a grief process.
Next is identifying goals and boundaries. Something we recommend is identifying boundaries for yourself and expectations for your own healing and progress, but then also identifying what expectations may you have for your partner or partners in the relationship, to make sure that all of those things are being identified before the therapeutic separation officially begins.
Mhm. And if I can add to that, Lindsay,
Yeah.
in the book, I think we go over it before you get to this part in the book. This came directly from our book. But one of the things that I really like to focus on with clients is, what is your intention for taking the therapeutic separation? And I have them write it out and we talk about it, because if you're going to go through something difficult like therapeutic separation, I think you really need to understand your why, so that this is what I'm hoping to see on the other side of this. And this is what's in it for me. And I find that when we take the time to really identify our intention, it makes the process much different.
Absolutely. So this is a sample therapeutic separation contract. And basically we have an example in our book as well, but there can be obviously other categories that we didn't cover. But the idea here is to really cover as much as possible, including even emergencies or unexpected deaths, how to communicate or what to do in the event that communication might need to happen if you're fully taking a break.
Yes, and this here is essentially what it would look like at the end of doing the work. Right before this, we walk you through all of these with lots of reflective questions so that you can really figure out what it needs to look like. And then you would move to this part where you write it out in more simple black and white terms.
So for the contracting session, we recommend at least a 2-hour period where you sit down and essentially have kind of all of what you've prepared ahead of time with your therapist, really identifying your goals. And essentially in this session, kind of things are more nailed down so that when you leave session, officially your therapeutic separation would begin, and the agreed upon period of time would begin at that time as well. Co-parenting and disclosure to children. This is like it's probably its own course in and of itself.
Yeah. Yes.
So I might recommend snapshotting this slide. We do have an entire chapter dedicated in our book on co-parenting and disclosure to children. For each family can be very different, but ultimately kind of where we land is communicate only to children what is in their benefit to know, and what is developmentally appropriate, and also is not weaponizing information against your partner to your child. Just probably can be very complicated in the moment, but bringing also anything and everything to your therapist to kind of process what might be helpful to weed out what might be in their benefit versus what might not.
Yeah, and if I could add to that, we don't have it in this presentation, but I recently pulled an article about the influence of temporary separation on
Mm.
the parental relationship with children. And one of the things that I highlighted from that study is that it said children from highly distressed marriages, divorce may be positive. I'm not telling you to take a divorce, but what I'm saying is, and you can almost take that and say therapeutic separation would be positive, right? And I think that's really important because when there's so much distress for the children, it almost feels like a relief that it can stop. That being said, I think preparing yourself as a parent for disclosing to your children is just as important as preparing for the therapeutic separation. So you should be spending a lot of time on that with your partner and your therapist.
Family and friends, we also go into this in the book as well, but we believe in mutual consent as to who will be shared with and what will be shared to help their foster more containment, because breaching of confidentiality can create even deeper wounding during this already very
Yes.
fragile period of time. So we do recommend that this also is covered in that contracting session, just so that there's a clear expectation. And obviously there are sometimes things that come up along the way. And so if that does happen at any point during the therapeutic separation, we recommend that also be addressed in the contracting session, so that as many circumstances can be covered as possible. But there's no way to know all of them, but we try to do as much as we can ahead of time. Individual growth is going to look different for each person, but really it's about going deeper and understanding how has your story affected what's happening in your life during and in this relationship. We are huge believers, and we go deeper into this in the book, that looking for ways to identify is there any unresolved trauma that's a part of your history that could be affecting what's happening in the relationship, or any of the responses that you have had, or is there anything that's happened that it might benefit you in the relationship to hold ownership in, as well as to make sure for someone that's in recovery, for them to really, number one, have solid sobriety, to have solid support systems in place, so that the responsibility is really on the person in recovery and in their community, and not on their partner if they were to reintegrate. Maybe I'll let you take this one.
Sure. So, if you can, it's probably also important to take a screenshot of this. So, a lot of the individual work that we're encouraging clients to do is to look at their attachment styles, trauma, core beliefs, insecurities, and fears about connection. That's here at the top of the chart. And what you see in relationship patterns, and this comes from EFT work, is that these attachment styles and trauma and beliefs, these are things constantly operating inside of us, right? And that, when we're in a relationship and we have a trigger, that is what gets triggered are these pieces here. And when there's a trigger, if we just look at partner A's cycle, what happens is that partner feels triggered. There's some sort of emotional reactivity. There is negative and unhelpful narratives that happen, and then some sort of behavioral reaction. That might be yelling, name calling, ignoring, stonewalling. It could be many things. That behavioral reaction then triggers the other partner. And then that partner goes through the same cycle. And if you were to map out the arguments you've had with your partner, you would see this cycle happen over and over. So a lot of our work is to interrupt this cycle. And we do that by looking at the top portion of attachment styles and fears about connection. So if you can do that individual work, you're going to be able to shift your part of the cycle. And when you can shift your part of the cycle, you shift the relationship cycle, right?
Absolutely. And therapeutic separation, I don't know if you can see my marker, is really about addressing this so that we can
Mhm.
really work on disrupting
Yes.
the cycles down here are happening. So major goals for a relationship is thinking about like what the goal would be later for reintegration is it are you both able or all parties in a relationship able to maintain differentiation, grow in empathy, really define individually and then also in their expectations for the relationship what healthy intimacy looks like, the willingness to reveal and receive, aka being more intimate and being vulnerable in interpersonal connection, and then
Mhm.
develop stronger and effective coping strategies. So at coming to the end or like the identified kind of landing place for a therapeutic separation, evaluating is going to be such an important skill to really kind of measure as you're going through this process. And that's where having at least both individual therapists there to kind of walk along with you through this process can be helpful for some of that objective support and feedback, and identifying if there's more time that's needed, have the goals been achieved or met? If the goals are not being met and there is a significant deficit in the goals being met, probably we need to look at extending the amount of time in the therapeutic separation. We don't recommend that we off ramp out of a therapeutic separation unless the majority of the goals and the significant ones have been achieved.
Yeah. For reintegration, it's really important to know that reintegration doesn't happen overnight. And I think, Lindsay, you do it very similarly to the way I do it, that I trickle in reintegration. It's not something that, we've done therapeutic separation for 90 days. On the 91st day, you move back in, we sleep in the same bed and all of that. It needs to slowly happen. So if things are looking like they're moving towards reintegration, then we might start to spend more time together. There might be dinners together, dates, or even overnight stays, weekends, that type of thing. If we get to the end of the 90 days and we're not quite sure, we might extend it, right? Or we might then start to work on reintegration. But it's really important that if you're going to reintegrate, that you also identify the boundaries of reintegration. Right. How are we going to reintegrate our finances and talking to the children about this and when our friends see us together and all of these different pieces that we visited before to create separation. Now we've got to look at healthy boundaries and reintegrating. I think the other piece is that emotional wellness has to be there. So there needs to be a level of differentiation, the balance of self and other. There has to be honesty, adaptability, proactive communication, being able to tolerate delayed gratification, being able to respond versus react. There's all these different markers that you want to see for emotional wellness to be a part of that reintegration process.
Developing a lot of those are about developing emotional capacity,
Yeah.
sit in tough conversations with your partner, and capacity kind of defines whether how long the therapeutic separation should be. So these are really the different elements of, when we look at what defines and builds healthy relationships, all of these different elements are kind of what we argue for in our book that need to be active for a repair to be helpful, successful, and healthy. So I'll probably not go over all of them, just for sake of time, but if you would like a copy of the slides, or if you want to snapshot this, you're more than welcome to. Permanent separation. So if at any point, you come to a place where there's recognition that, hey, like reconciliation is not going to happen, I think I'm getting more confirmation, or I'm feeling more secure, and that like I don't want to move forward in this relationship, but I'm not at a point where I would like to officially like divorce, or legally separate. Essentially, you'd work with your therapist, and altogether probably have another contracting session where you define kind of the terms of a permanent separation.
And in the book, we really spend a lot of time, like in this chapter, of preparing to have that conversation, because it's a difficult one. And so we do walk you through prepping yourself and also prepping how to share it with your partner that you wouldn't like to move forward in the relationship.
So here is just kind of an overview of all of the chapters of our book, kind of covering all the different elements of what we discussed. Our book is filled with tons of evaluative quizzes to help you kind of more clearly identify what might be helpful, as well as what type of separation might be helpful for you or your clients. But our book is there's a ton of space for self-reflection and evaluation. So we have quite a bit of content in there, but it is meant to be used to the absolute max, as well as if there are portions that don't apply or aren't helpful to you, it's totally okay for certain portions to be skipped and certain portions to be used. So yeah, that covers kind of all the things.
So from a practical standpoint, and I did put the Amazon link for the workbook in the chat, but you can get it on Amazon. But I'm thinking from a practical standpoint, you've got two people, you need two workbooks because
Yes.
like, okay, but that's just a practical thing. I thought it was really interesting when we were talking about the bias, because I've heard the bias too of like, well, if you separate, you're automatically going to get divorced. And that has prevented people from taking that separation because they're perceiving that, well, if we do that, we're throwing in the towel.
Yeah, research does not affirm that. Research
Exactly. I thought that was so
actually,
interesting when you said
yeah,
that.
research doesn't really affirm anything other than ambiguous separations seem to be more distressing than helpful. Although sometimes beneficial for kiddos to not have the high level of tension.
Yeah.
And I hear lots of people so I had a question on the how often does it go from, no, wait, can therapeutic and legal be happening at the same time? Like, can you have or are they just completely different categories? Because I wondered about that. Like, if you're doing a therapeutic separation, are you staying out of legal separation?
Usually a person would take legal separation because they are not wanting to have a divorce, usually for cultural or religious reasons.
Okay.
And so they might be further down the line of wanting to separate. Um, I'm sure there are, and Lindsay, maybe you can speak on it. Maybe there are situations where a couple might still do this work to see if reconciliation is possible or to work through some of these things. But to my understanding, they are a little bit different. Do you have a different thought on that, Lindsay?
Yeah, no, I wouldn't necessarily recommend it from the get-go, but I could see some circumstances where maybe within a coupleship they're like, you know what, we've kind of reached this place, but we're willing to maybe do some of this work to see if it could be helpful, but we're going to keep this train moving in that direction. Not ideal, but that might be a circumstance where I could see that happening.
Okay, I'm going to ask you to stop sharing your screen, and I have way more questions, but I'm going to just invite you back to come back because we've got a whole bunch of questions that others have asked. So, okay, so please, wait, let's start. What would an in-house therapeutic separation look like other than having separate bedrooms and no physical contact? We are not further along since last July, so I know we have been doing something wrong. I'm the betrayed partner. Betrayer is sobriety, not recovery.
So go for it, Stevie.
Okay. I was gonna say, separate bedrooms, no physical contact. That's a good start. A lot of times when I think, Lindsay, you would agree, when we see couples do this, but they don't have the other structures in place, it is ambiguous. And that's where you're not really going to see movement because now we're more in a roommate situation. And I have had couples take in-home separations and it has worked. It's hard because the boundaries do have to be in place. There does have to be quite a level of separation, but it's that individual work that you both need to be doing that would help move you forward. Is there anything you'd add to that, Lindsay?
No, I think you nailed it. There has to
Okay.
be, and also like just clearly defined goals of what would be worked on during that time, as well as kind of check-ins to see if the boundaries are being honored. Because sometimes we think we're moving into therapeutic separation, but we're actually going into ambiguous separation while both people are in therapy, and this is a very different thing.
Mhm. Yes.
Yeah, I was thinking that sounds like ambiguous, even though you're still in the same house, because there's,
Yeah.
yeah, so, okay.
Mhm.
Complicated stuff. Okay, please speak to the therapeutic separation with integrity abuse or an abusive partner who makes all things difficult and can abuse even from a distance. How to be safe even with this. How to prevent this from being used against a betrayed partner if it leads to divorce and custody.
Yeah, obviously if there's active and ongoing abuse, therapy is actually what's called contraindicated. So we don't recommend couples work specifically if there's like an ongoing pattern of abuse. Safety is like of the utmost importance. I probably wouldn't necessarily recommend starting the process of therapeutic separation unless you have two open and willing parties. Otherwise, what ends up happening is it becomes kind of a prolonged exposure to the end of a relationship, which can feel almost more distressing than helpful. And the entire goal of a therapeutic separation is to be of the most help. I think sometimes with people I've worked with, they find along the way their own voice and clarity as to what they're needing. But I don't know if I would necessarily initiate or try to move into a therapeutic separation if there's active abuse. I hope that makes sense.
Yes, and what I would add to that is in a lot of these cases, at least the ones I've worked at, separation is needed. But to highlight what Lindsay said, she said therapeutic separation. So therapeutic separation, like we are working on things together, we're addressing the relationship cycle. There is some couples work included. And so that's why she's saying therapeutic separation isn't recommended. But if you're in a situation where there is ongoing abuse and that abuse is even happening from a distance, some level of separation and boundaries might be needed, and working with a trauma therapist who specializes in abuse and all things related is probably going to be the key piece here.
Okay, the next one. What are some ideas for doing a controlled in-house separation in a small space with both people at home, mostly 24/7? My partner is showing up to do the work, but it's acute recovery, no disclosure, and an abuse cycle. We do not have physical or sexual contact. We sleep in separate rooms. There is a lack of consistent integrity, emotional stability, and safety. We have lots of interaction around have tos, his recovery and my healing and FaceTime because of the square footage of our home.
Yeah, I think this is a great question. And I think it kind of piggybacks on what we were just talking about, in that if there's not two willing and open participants in a therapeutic separation, we would recommend taking more space. And practically, what that might look like is really beefing up the individual support and making sure that you as a partner have the support and connection with either your therapist or supportive community. Specifically, I find that group therapy can be really helpful. But I don't know if I would necessarily initiate a therapeutic separation unless your partner is willing. And practically, it's really holding yourself to the boundaries of not engaging, even when your partner's trying to. If your partner's trying to violate the boundaries, a boundary is what you will or won't do. And so your job is to honor what you've committed to. And if your partner is
Mhm.
really not and is kind of going into the realm of very much like violating boundaries, then probably further separation would be encouraged.
Yeah, and I think something that we highlight in the book is that a controlled in-home separation is typically more of a psychological separation. So cool as a partner to not ask questions, to not try to manage the recovery plan, to make sure meetings are happening, work is being done. But that is part of that controlled separation. And while it can feel very overwhelming, it's much more empowering actually in those moments to have maybe scheduled check-ins or certain things in place to get that information. But a big piece of that in home is that you have to stay psychologically separated to a degree. Right? We're not ignoring each other, but we are trying to keep some sense of separation.
I'm almost here like this is, well, if a controlled separation in home is not working, then what I kind of hear is like level up. It may need to be more distance.
Yes.
So either better boundaries about and honoring the boundaries within the home, or
More distance.
yeah, more. Okay, gotcha.
Yes. And
Okay.
individual work.
Yes.
Sorry
Yeah.
to come back to that, but the
Yeah.
work has to be there. Yeah.
Yes. Okay. And then the next one is just thank you so much. Yes, I agree. This is so helpful. I've got a whole list of questions. Can you please expand on how to have a healthy in-home separation when you can't afford out of home? And she adds, in our state, VA, Virginia, you have to legally separate with a formal document for 1 year before you can divorce. It has to be separate homes. Wow.
Mhm. I think I saw the same in Louisiana in one of the research studies. Yeah.
That's so interesting. Yeah. Well, not that everything is about boundaries, but we are a huge believer of like talk about all the things, and don't assume that your partner just kind of gets it. I think in the contracting session, if you're going to do a controlled separation, I think the boundaries become even more important. And make sure to address and think through, like, if you both are going to be downstairs making breakfast at the same time, what the expectation is that, hey, even when we're in the same space, like, we're not gonna like initiate a couples check-in. We're not gonna make like slide side comments or like, pop off at each other. We're really going to hold with steadfastness the intention and boundaries. Otherwise we start kind of going back into a cycle that could be very much more traumatizing than helpful. But we don't recommend like hanging out for indefinite periods of time. If there's like TV time in the den or in family room, intentionally trying to keep your distance from your partner to avoid kind of sliding back into old patterns. We want a controlled separation to really feel different and to feel like you're really disconnecting from your partner.
Yes, and I think one of the difficult things with that is communication. So when we're talking about boundaries, where I see my clients struggle, is that they typically text each other throughout the day or call each other, or they're checking in at the end of the day. How was your day at work? And those are all things that would shift at least for a period of time when we have an in-home separation, right? So I'm not texting you throughout the day. If there's something that's logistics that I have to text, like something is happening in the home, or can you please grab this on the way home if that is appropriate, or something's happening with one of the children, that's when you might have communication. But essentially, we are stopping communication. We're not checking in about each other's days. We're interacting because we need to accomplish something. And outside of that, we have this level of separation, right?
So there's a question, we're gonna get to the in-between one, but what about having meals together if you're doing an in-home separation? I'm hearing that's probably not a great option.
Generally, we don't recommend it. I mean, I know there are some circumstances, like if you're living in a very small home environment and there's nowhere else to go, we don't recommend it, but we understand sometimes it's unavoidable. And so if you do end up in that circumstance, it's really just keeping it very light, not talking about the hot topic issues, and really kind of keeping it to almost like coworker mode, where you're probably not going into like active, complex conversations about like the deepest things in your life with coworkers. You're generally keeping it pretty light, with the intention of just really holding those boundaries.
And I've had some clients that, they have kids together, so it's a bit awkward to have the meals separately. And sometimes in an in-home separation, your children don't always know that you're in an in-home separation. And so in those cases, the boundary you want to have is about the topics you're talking about. And like again, maintaining some sort of space there. I think that that's important, and also not using like the children in those circumstances, because that can happen a lot. So if you're having meals together, it should be because you have to.
Yeah, I've heard of people going like, I have the kitchen from this time to this time, and you have the kitchen from that time to that
Mhm.
time. So, but with kids, like, yeah, I was like, oh yeah, if you've got kids, you may be having family dinner. So, okay. The question is, if you are doing a therapeutic separation, is that the time of a full therapeutic disclosure as well? Is that always needed? So, good questions.
That's a great question, and it would differ for each person. I would say generally I would not recommend it, just because that space and time can almost breed room for potentially more triggers if you're getting a lot of information and you have very low contact with your partner. There probably are some circumstances where that might be what's recommended, but generally we don't like encourage people to engage a therapeutic separation and go through the disclosure process, because they are very different types of work, and might be I could see for some people being more complicated than helpful.
Anything for you, Stevie, on that one?
I think Lindsay got it.
Okay. All right. Then the next one is, uh, wait, gotta put this in. What would you consider my cat, I'm sorry, my cat is being terrible. What would be considered too long for a therapeutic separation? Our goal was initially 6 months, but because he hasn't been able to maintain sobriety, I'm wondering if we need to do a year. That's a great question. Like, I was kind of surprised when you said 90 days as a minimum, because I was like, wow. So this is really helpful to have some kind of gauge on the timing.
Absolutely. I have a couple that when they came to me, they were in a bit of an ambiguous separation for about 6 months. And from there, we decided to actually extend their separation 6 months. And it has been in that new 6 months that they have realized they want even more time. Right. And sometimes that happens because for this partner specifically, she has, I think, 3 decades of lying, gaslighting, and abuse. And a lot of the way her husband's showing up now, it's very healthy, and he's showing up in a great way, but he's also saying things that are very similar to what he said before when he was lying. And so she has a lot of trust building to do, and she has a lot of inner work to do in trusting herself. And so for them to extend it even past a year, that has actually been healing for them. There are other couples, and Lindsay might be able to speak to that, that we wouldn't recommend going that long, right? Because at that point we might be in avoidance, we might be in some really unhealthy behavior. So it really depends on the couple and your goals and where you're at. But if you've been doing an ambiguous separation for 6 months, I would at least try a therapeutic one to see if that helps move you forward. Do you want to add to that, Lindsay?
No, I think you nailed it. I guess the only piece that I threw in there is the length of time is totally connected to whether are both people willing and working on the issues that have been discussed? Are the goals being achieved? And sometimes genuinely we just need more time. And if that time, the length of time feels productive, then I'd recommend it. I wouldn't necessarily identify just a solid amount of time that everybody needs, or if to there's not like an amount of time that's too much. It really comes down to each individual relationship. Because for some people, we find that they're wanting to extend the amount of time, but it's actually a strategy for avoidance of intimacy, and that's what we don't want. And so, if ever kind of that bridge is being crossed, that's typically when we as therapists will step in and kind of challenge and say, "Hey, I think we're actually reaching a point where reintegration might be worth us dipping our toe into reintegrating and seeing, is there an active toxic cycle, or has there been more progress in your ability to hit all those different goals that in one of the slides that we had covered for a healthy relationship?"
So, but one of the things I'm reading with this is he hasn't been able to maintain sobriety. So,
Right.
so that one, like, I'm wondering about that. Is it helpful to continue to, in the hope that he can get some solid recovery, or
I think it would come down to like, is he actively working on
Oh,
establishing
that makes sense.
sobriety.
Okay, all right.
If he's actively working on establishing sobriety, then I think extending would be wise. If he is kind of in a zone where he's not really trying, then I don't know if I would extend at that point. I might move, further into taking more space. Because if someone's actively engaging in relapse behaviors, we're kind of moving away from therapeutic separation into your partner's not actively, where only one person's doing a therapeutic separation, and that's like an impossible journey. Both have to be willing.
Okay, that's very helpful. Thank you. Okay, what would you recommend looking for in a therapist to support a therapeutic separation process, and how do you get therapists to work together on this if they are from separate practices? Another great question.
Mhm. I think when you're looking for a therapist, you want to look for someone who's either familiar with therapeutic separation or is willing to get familiar with therapeutic separation, because sometimes therapists just don't know that there's a process. But if they're willing, it's a process they can follow. They can use the book to guide you through it. They can reach out to us to help support them.
Yes.
I do this work a lot as a couples therapist and use the individual therapist as like adjunctive therapist to help support the process. And so even just finding a couples therapist that can help you with the therapeutic separation is helpful. But really, you just need to let your therapist know you'd like them to collaborate and to send you a release of information. And then they will most likely reach out to that other therapist and collaborate. The majority of us want to do that anyways, because that information is helpful. Would you add to that, Lindsay? I don't know if you
Yeah,
have.
I would also throw out there CSATs or certified sex addiction therapists. I would say probably flow best in their training with using this model. And so
Mhm.
if I were looking for a therapist, not knowing who I should go with, I'd probably look for a CSAT. And even just having them paired with the workbook probably would give you the support you need.
Mhm.
And I heard that both of you are doing a training for CSATs tomorrow. So there will be a new batch of therapists that have education specifically on this. This will be, the CSATs specifically. But, and this is true with codependents and lots of therapists really want to learn and do their best work. So, you going, hey, I have this workbook, many will, and that would be very telling of the therapist. If they are going like all in helping you, that would be really helpful.
Mhm.
Okay. Hopefully you've got time for one more question. We've got 2 minutes and then we have to leave. Please speak more to children and their needs and the confusion they experience with the back and forth.
Yeah, this is a whole topic in and of itself and such a good question, because the more that we can communicate clearly to our kids and have a unified message, the less likely it is to create disruption in their home environment. And so I would say having a unified message and essentially developing a script for what would be communicated to the children is most beneficial to them, as well as we do recommend having already identified support, therapeutic support, or be maintaining an open stance if your kiddo is showing any symptoms or signs of dysregulation or acting out behaviors or a mental health decline, to really support them with adequate therapeutic support is really important. So I wish we had more time for this question. It's such a good
I
one.
do too, because the next question is, I have to point out how with kids sucking it up to have civilized meals and some family shared time would be best for them. It would be so confusing for kids with that. And, and I'm not sure it is best for the children. So,
Yeah,
but
really depends on the coupleship.
yeah, and what level, like you said, some people don't even know, the kids don't even know there's a separation going on, because
Yeah.
the adults are able to adult enough to, navigate that space. So
Yeah. Tammy, can I add one last thing real quick?
please,
I'm sorry. This is why we highlight it's so important to work with a therapist, because all of these nuances your therapist should be able to help you with. And I saw some questions about the addict using separation to avoid. Your therapist or your couples therapist would be able to help with all of those things. There are so many nuances in this. There's times Lindsay and I have worked together and said they cannot take a separation right now because there's too much avoidance, or we're in this part of the process. It would be very unhelpful. So working with a therapist sometimes is going to be the most helpful way to navigate those difficulties.
So we're out of time. I'm going to ask them to come back and I'm sure they'll say yes. And we'll do this again and bring your questions. I'll promote the heck out of it then too. Thank you both. This was so amazing. So grateful for it. Bye, everyone.
Thank you for having us.